VCU Massey. We really appreciate you taking the time to come and visit us. I'm delighted to share some thoughts and concepts about our Massey NCORE program. The NCORE is the NCI's Community Oncology Research Program. There's 46 NCORE programs around the country, and they really help form a platform whereby the innovation through clinical trials from the NCI and other cooperative groups can be brought to our cancer patients in the community, because most of our cancer patients are actually being treated in the community, not all in the academic centers. So really the NCORE program allows a vehicle for those clinical trials to bring those innovative drugs to our patients in the community. As Dr. Wynn mentioned, there are 14 minority underserved NCOREs, which are really focused on serving the minority underserved population and ensuring that there is a fair representation of minority underserved patients on clinical trials. We don't want those patients to be left out. So we are one of those 14 minority underserved NCORs in the country. That's something we really pride ourselves on. And I think because we are also an NCI designated cancer center, we really feel that uniquely puts us in a position to take some of the innovation that you saw firsthand in the lab today and use it to the benefit of our patients in our catchment area. No matter what their zip code is, it really should be accessible to all. Massey has had a long commitment with the minority community oncology programs dating back to 1990. So it's a long 30-year history. As Dr. Wynn already mentioned, it's really a lot of the leaders that came beforehand as well. So we're extremely proud of that. And the results speak for themselves. We have been, over the years, able to maintain 30 trials. And that's something that we are extremely proud of. Now, obviously, all of this work requires a village, literally. We are really fortunate to have some wonderful people here at VCU and at the Massey Cancer Center at different levels. We have amazing scientists. We have providers who take care of patients. We have our clinical trial staff, nurses and other staff who do an awesome job, and our nurses who work in the clinic. And then we have our affiliates, because our NCORE is built on us as kind of being the mothership here in Richmond, but we have our community affiliates, some of whom are in Richmond, but some of whom are rural Virginia sites, which is equally important that rural Virginians have access as well as the underserved population of the greater Richmond area. So we have 7 affiliate organizations around the state and a total of 19 actual sites that are available for patients to be seen and access clinical trials. And that really spreads us out on the map across the Commonwealth of Virginia. We go as far north as Winchester, South Hill in the south, on the west, Lynchburg and Virginia Beach on the Atlantic, and of course, the greater Richmond, Petersburg metro area. In terms of otherwise, our accrual to these, as I mentioned, we maintain a good minority accrual, but we also have a lot of treatment trials. About right now in our network, upwards of 30 clinical trials are available for our affiliate sites and for us to enroll patients on. That includes treatment trials and also cancer prevention and control studies, which are very important, and cancer care and delivery, which Dr. Shepard is the lead for and will tell you more about. The one study in particular that I wanted to highlight is, and the timing is impeccable because it just opened 12 days ago, is the Cancer Moonshot Biobank Study. And I know that's a name that's dear to you because of the Cancer Moonshot Initiative that was led by then Vice President Biden. And we really, are now seeing the fruit of that, from the work from 4 years ago, and are really excited that we are able to open that study here at VCU and at Lynchburg, which is one of our rural sites, which means that a patient who's there in Lynchburg does not have to drive 3 to 4 hours to come here, and they can get a biopsy there. Their sample is then sent to the NCI, and then the results of that biopsy can help put them on a clinical trial or appropriate treatment. So these are really some of the reasons why a lot of us have come here to VCU Massey and stay here, but we realize there's still a lot more work that needs to be done. but we're excited for the future, especially with Dr. Wynn at our helm, our fearless leader. Thank you.
Thank you.
I'm going to next introduce Dr. Shell, who is an amazing researcher in her own right, world class, but who also is a student like I am of Harold P. Freeman, who recognizes that sometimes in science there's a disconnect between the discovery sciences and the implementation sciences. Mm-hmm. And we have also considered that there's also a third disconnect, that sometimes the implementation of that into the community. As such, she's our associate director of community outreach engagement, and she's going to tell you a little bit more about what it is that she does, but also our philosophy here at the Massey.
Mm-hmm. Absolutely. Thank you so much, Dr. Wynn. And first, I'd like to just start by thanking you, Dr. Biden, and also you, Dr. Sharpless, for the programs that you have for underrepresented minorities. I stand on the shoulders of those before me, and I'm a recipient and have benefited from those training programs. And so I'd just like to say thank you for that. Because of those programs and that investment from the Cancer Center, I'm here, and I can pay it forward to other minorities and underserved individuals. So just imagine being a 7-year-old from an underrepresented minority background and hearing the adults in your life talk about that someone you know has cancer. You don't know what cancer is, but you know it's bad, and you see what it does. You've seen its results. And so you make a declaration and you pray that you're never going to get cancer. Well, you get a little older and you do get a diagnosis, and that diagnosis is devastating to your family. Well, at Massey, we recognize that cancer does not just impact individuals, but it impacts families and communities. And as a result, we work to engage the community. And I'm excited that I'm here because we are working with our community to figure out how can we reimagine what a cancer center should be. We don't just want to be a place where people come when they're sick. We don't want to be a place that only produces great science, but it doesn't translate to the community. We see ourselves truly as Virginia's cancer center, the Cancer Center for Virginia. And so we have a community to bench model, and this model fosters bi-directional relationships between the Cancer Center and the community, where we bring community members in, we hear and learn from them, and then we are in the community and we learn what their priorities are. We also put our outreach and delivery programs in community settings like libraries. And this is helping us to understand how we can truly make a difference in the community. Community engagement activities also are informing our science. We've had community forums, for example, with breast cancer, and as you mentioned, talking about the art of care. And these forums have helped to focus 2 trials that we have for African American women. You may know that African American women are 40% more likely to die with the diagnosis of breast cancer. And so working with community stakeholders, they've helped to refine our protocols to improve uptake of treatment for African American women, as well as uptake of genetic counseling. Just last month, we trained our first cohort of breast cancer survivors who will be champions in the community, and they'll be paid and be a part of our study. Mm-hmm. And so we're very excited about that. One of the things that we recognize at Massey is that if we really want to change the place, then we've got to be ready to change the face. We have to make sure that our faces represent the communities that we serve. In 2014, the 7-year-old that I mentioned earlier was diagnosed with another cancer. This time it was breast cancer, triple-negative breast cancer. And what could have seemed hopeless, because the survival for that cancer is not as good, was hopeful because of faith, access to an NCI-designated cancer center, timely treatment, and a supportive community. She survived to thrive, and as a result, will have another birthday tomorrow. But today, she's sitting next to the First Lady of the United States of America. And for us, that's what it means to thrive. The community to bench model that power, and we want all Virginians to thrive in that way. Thank you so much for your time.
Wow. That was so powerful. I mean, really, I've heard just in the short time that I've been here, I met, Dr. Sharpless told me about, well, took me to meet two people that the NCI supported and gave grants that they're now studying, just like you did. And I love that you went out into the community. One of the things that I've done for years now, even when Joe was in the Senate and then as vice president, is travel the country and go to the rural areas that you're talking about, because they're desperate. They are desperate for help. And just maybe, I think it was 2 years ago, I was in the Navajo Nation, and I helped open the first chemotherapy center in that nation. And I want to tell you that people were driving 2 hours to get treatment and then driving 2 hours back. I mean, so that's just one small example of rural America and their needs, and how you're right. I mean, it's the community. We've got to get the trials out to people. We've got to get knowledge. We've got to get education. There's so much we have to do, but with your faith in Friday's program, we're going to do this. We're going to take it across the nation and get people and make them aware. Really.
I can use this one? Okay, thank you.
Happy birthday.
Thank you.
So, this is just an example of really what we do in the context of partnerships. I'll tell you that there are a couple partners that we couldn't do without. One are the folks in the Massey Nation. And in fact, within that, there's a new generation of young people led by the chair called Connor Ashby, who is teaching younger people within this Richmond area and beyond how philanthropy actually works and how to support the cancer center. The other thing is, our other partners, faith-based partners, has meant so much to all of us. And in fact, I want you to hear from these are people that I love. And they know that we are in this fight together. Rudine Ursha Haynes, I could go on and on, but I'm told that the time is short here. She's a partner at Hunt & Andrews Kurt LLP. She's a member of that Massey Nation. And in fact, she is really what we call a true community champion. This Facts, Faith, and Friday was really like Gladys Knight in the pitch. You can't have one without the other.
Yeah. There
There are three of us that really got together in a context of recognizing the importance of this. The other person is Pastor Gray. Pastor Gray is a true leader. I mean, he's a harken back to what we talk about when you talk about faith-based leaders who are not only providing their ecumenical activities, but understands that the church is an anchor institution. These faith-based organizations are anchor institutions and can do more, and has stepped up to the plate and showed up and showed out at every place he's been, and in fact brought others with him. That whole crew, and we're just showing you two of that Facts, Faith, and Friday, but it runs deep with a number of people throughout this community. So I want you to hear from them about Facts, Faith, and Friday, and a little bit about what they've been doing and where we're going.
Thank you, Dr. Lynn. First of all, thank you so much, Dr. Biden, for being with us here today. I know you have tremendous demands in your time, so we appreciate your sharing with us. And thank you, Dr. Sharpless, for being here, in person as opposed to virtually. So when I first learned about Dr. Wynn becoming the next director of Massey, I got excited for a whole host of reasons. But one reason I was particularly excited was the fact that at the time, he was the only African-American director of an NCI-designated cancer center. I was so excited about this. I thought this was so important. I wanted to scream it off the rooftops because growing up in a Black community, I realized that there is this level of apprehension about talking about subjects related to cancer, anything and all things related to cancer. And that, of course, is a significant impediment to folks getting great cancer screenings or cancer prevention, and also just having access to high quality medical care for their ailments. So I was excited, and I was thinking, how could I sort of make a connection between Dr. Wynn, so people could hear and see his philosophy and passion at VCU about sort of making sure that you have state-of-the-art, innovative, high-quality sort of research and cancer treatments and cancer trials, and that's what he cared about bringing to the community, implementing in the community. So I thought it was very important that he be introduced to Black leaders, and particularly Black faith leaders. As we know, the church is the mosque, wherever it is that you worship, is a very central bedrock institution in the Black community. So I sort of set out and made it my mission. Again, you heard my day job as a corporate finance attorney. This is not what I normally do. But I made it my mission to connect Dr. Wynn with faith leaders. And of course, one of the esteemed faith leaders in Richmond is my former pastor, Pastor F. Todd Gray, who I met when I was at Fifth Street Baptist Church. And he was sort of the embodiment of someone who's passionate about the community. He had a proven track record of being engaged in community outreach. So I was wondering if I got, Pastor Todd Gray together with Dr. Wynn, of course, good things would happen. So, of course, I reached out to Pastor Gray, and he wonderfully accepted this invitation to sort of arrange a meeting between the two. Well, this meeting happened after the first stay-at-home order had been issued. So that meeting happened virtually, a Zoom call. And there are any number of topics that we covered during that conversation. But the one thing that sticks out in my mind was that we talked about the fact that there's so much misinformation and inaccurate information swirling in the community about COVID, how it's transmitted, how you can get tested for it. And again, remember back in April, it was all very novel. So there's lots of confusion. And I was particularly concerned about the confusion that was created in the Black faith community. So Dr. Wynn, during this call, just graciously offered to both Pastor Gray and I to have a conversation with folks in the community about COVID, to sort of be a resource and to answer any questions that we might have. He said he'd be available no matter when we wanted to do it. So we're like, okay, how about Friday at 3? And he was like, okay, we'll do Friday at 3. And so we've had these Facts and Faith weekly conversations every week at 3. And we've invited, Black faith leaders, lay people, anybody who's just really passionate about what we can do more in the community. And of course, as things do, things evolve. Our conversations have evolved. And at this point, I'm going to be quiet, and I'm going to pass the baton over to my pastor, Pastor F. Todd Gray, to talk about, what's become of these conversations, and more importantly, what's been the overall impact in our community and beyond. Sure.
Dr. Biden, it's a pleasure to meet you. I have great respect for both you and your husband. Dr. Sharpless, I'm grateful to you as well. As Rudine has stated, this was a fortuitous coming together because we had no idea that we were going to face the pandemic. And early in the process, there was a lot of confusion in our churches in terms of practice and protocol, how we ought to respond to it. Many of us had lost colleagues and members, and the accurate and timely information that we received from Dr. Wynn each week, we were receiving information in real time that we could not have received anywhere else. And it informed us as to dealing with opening churches when we could open our churches, dealing with hygiene and sanitation issues. We have a child development center. It was very, very helpful in terms of dealing with practices that way. And so, one of the first benefits of our coming together was just receiving information so that we could successfully govern our congregations. But beyond that, there was the issue of trust, because there's always been a reluctance in the African American community about certain things in the medical community. And for Dr. Wynn to offer himself, plus he shares our experience, it made it easy or easier to establish trust and to have credible sources for dealing with the pandemic, getting tests, and even more so now in terms of getting vaccines and having people that were willing to do vaccines. And I do want to thank Dr. Wynn, and I want to thank VCU, because we've had persons across various disciplines to address that Facts and Faith Friday call. The other thing that I would share is that it helped us in terms of dealing with advocacy so that we could get testing in underserved communities. Right now, we're in the process of trying to get those communities that are not being serviced, like the majority community in certain areas, getting their vaccines. And we've developed a wonderful relationship with the Virginia Department of Health. But everybody can use some pushing. And so there have been some conversations where we have pushed to make sure that our communities were represented in getting these doses of vaccine. I could say a lot of things because we dealt with more than just what would be traditional health issues. Everything that's going on in our community of interest to the faith community, we've had discussions of. We've had persons from the governor's office, we've had the mayor, former mayor on, we've had common attorneys on, we had the police chief on, we've had election officials on, et cetera, et cetera, et cetera. It's gone way beyond just traditional health issues. But I think that it bodes well for the kind of a relationship that we'll have beyond the pandemic. I think that what we have done has been innovative. It has been very, very beneficial to the African American community. And I think that it's been very, very helpful in terms of establishing that collaboration with the medical community so that they feel as if they can trust it.
Yes,
So by and large, it's just been a wonderful, wonderful collaboration.
that's great to hear. Thanks for what you're doing, really. Because you're right, it's all about trust.
Thank you.
So I'm going to thank the panelists for your remarks and for your partnership. And literally, we're going to get through COVID, of that I'm certain of. Dr. Biden, do you have any final thoughts or final comments?
Well, this facility is amazing. What I've seen, the research here, what's going on with cancer and how you're trying to, really address the health disparities in our country. It's about time, that we started getting really serious about this. And, and this pandemic has really shined this bright, hot light on this subject. And I must say, all over this country, what I have found is that the churches are really bringing the communities together. Because whether it's education, whether it's food, whether it's the vaccinations, you are the centers. And because it's all about trust, it's all about trust. And so I think that the communities of color, they trust you. And now I think it's important that they learn to trust the federal government again, because we want to partner.
Yeah.
So thank you.